Hey everyone, and welcome. Today, we're going to tackle a concept that was a huge topic of conversation in our hospital's Culture Coalition, and that's Greg McKeown's really powerful book, Essentialism. So we've put together this explainer specifically for you, the busy physicians, nurses, and APPs who are out there leading teams and taking care of our most complex patients.
I want to start with a question. Have you ever had that feeling, you're completely overworked, stretched thin, running from one thing to the next, but at the same time you feel underutilized? At the end of a crazy day, you're left wondering if your energy really went to the things that mattered most. You were definitely busy, but were you truly productive?
Okay, so let's dive in. We're actually going to frame this whole thing like a clinical case, a format I think you'll find pretty familiar. First, we'll diagnose the problem, what we're calling the leader's dilemma. Then, we'll write a prescription, the essentialist mindset. After that, we'll lay out a three-part treatment plan, talk about a really critical skill you'll need for it, the art of saying no, and finally, we'll look at the outcome we're all aiming for, less but better care. All right, first up, let's diagnose the condition. We'll call it non-essentialism. And let me tell you, its symptoms are absolutely everywhere in modern healthcare. I mean, the pressure to increase patient throughput, to serve on more committees, and to just be constantly available, it's relentless. This comparison really nails our daily reality, doesn't it? The non-essentialist is always reacting to whatever is the loudest alarm, the most urgent task, feeling like they have to do it all. But the essentialist, they pause. They actually stop and ask, is this the most important thing I could be doing right now? They understand that saying yes to some administrative meeting means you're also saying no to something else. Maybe something like spending an extra 5 critical minutes at the bedside of a deteriorating patient. It's the huge difference between living by default and living by design. And this quote just brilliantly illustrates the real cost of living by default. McKeown tells this deeply personal story about being at the hospital right after his daughter was born. A colleague called, pressuring him to attend a client meeting. So, feeling that pressure, he went. He left his wife and his newborn baby, only to find out the meeting was completely unimportant. It was just a painful, powerful lesson. When we don't protect what is truly essential, our time and our energy get hijacked by other people's agendas. So if non-essentialism is the diagnosis, what's the prescription? Let's talk about the solution. We're going to see how this approach builds a framework for not just surviving in your leadership role, but actually thriving. Now, this is so crucial. This is not about managing your time better or trying to do more with less. We all know that's just a recipe for burnout. No, essentialism is the disciplined pursuit of doing only the right things. It's about focusing on those vital few activities that really align with your highest purpose as a healthcare leader. And it's really important not to confuse essentialism with minimalism. Minimalism can sometimes feel like just stripping everything away, what you might call a cold clarity. Essentialism is different. It's about creating warm clarity. It's about being intentional, filling your professional life with the things that truly matter, like mentoring your team, pushing patient care forward, building strong relationships, and clearing out all the clutter that just gets in the way.
McKeown uses this perfect analogy. Think of your professional life like a closet. If you don't have a system, it just gets crammed with all this stuff. Low-impact committees, pointless meetings, administrative tasks you never really wear. Essentialism is the system you use to periodically and intentionally clean out that closet. That's how you make space for the high-value work that you actually love and that truly moves the needle on patient outcomes.
Okay, now for the treatment plan. This is the really actionable part of our prescription. It's a 3-part system you can start applying today to put essentialism into practice. The process itself is pretty simple, but it is so powerful. First, you explore. Think of it like forming a differential diagnosis. You're evaluating every single request that comes your way. Second, you eliminate the stuff that's not essential. And finally, you execute. This is about creating systems that make the essential path the easiest one to take. For example, maybe you block out the first hour of your day as protected time to round on your most complex patients before your inbox has a chance to take over. Now, let's talk about that second step, eliminate. Because it really hinges on a skill that, let's be honest, many of us in the helping professions find incredibly difficult. And that is the art of saying no. Yeah, saying no can feel super awkward, but it is absolutely essential. So instead of that impulsive yes, try something called the pregnant pause. Just taking a beat, a moment of silence can stop you from overcommitting. Or you could try the no but approach. Like, no, I can't join that committee, but I know our new charge nurse is looking for leadership opportunities and would be a great fit. It's so important to remember you're rejecting a request, not a person, and that every yes is a no to something else. So choose your yeses wisely. So, why does all of this matter? Why is this disciplined pursuit so critical for you, for your team, and especially for your patients in such a demanding hospital setting? Because ultimately, when you as a leader start to model this disciplined pursuit of less but better, the impact is profound. You'll feel more in control and less overwhelmed. Your team will become more focused, more energized, and most importantly, all of your collective effort gets channeled directly into what improves patient care and what brings back the joy in your work. You're no longer just busy, you're effective. In the end, essentialism is really so much more than a productivity strategy. It's a challenge, really, to answer this profound question from the poet Mary Oliver. By choosing to focus on the essential, you're not just organizing your workday, you're designing a life and a career of purpose, contribution, and meaning. And that choice is yours to make.